Hello, my name is Amy and I am one of the living donor coordinators here at Froedtert Hospital. Today we are going to be discussing living kidney donation. We will talk about the benefits of a living kidney donor transplant, who can be a living kidney donor, as well as the different options available to living kidney donors, and how to find a possible living donor. Living kidney donation is just one of the treatment options for end-stage renal disease. There are several benefits to having a living kidney donor. Some of these benefits include a shorter wait time to transplant. In some circumstances, the recipient is able to avoid dialysis. Living kidney donors typically start functioning sooner after transplant, as well as they have a lower risk of rejection after transplant. Living kidney donors tend to last a little longer than deceased donor kidneys, on average about 12 years, as well as living kidney donation is a planned event. This allows for our team to ensure our recipient is in optimal health prior to surgery. Who can be a living donor? Anyone can be a living kidney donor. A parent, a spouse, an adult child, an aunt, an uncle, a cousin, a friend, a coworker, or even a complete stranger. All donors must be in excellent health with no medical problems that could increase their risk of developing kidney disease after donation, as well as all donors need to be at least age 18 and able to give consent. They must be free of any pressure to donate and be fully able to understand all risks associated with kidney donation. Donors must also be financially prepared. All costs related to donation, such as the evaluation, workup, and surgery, would be covered for the donor under the recipient's insurance. However, things that would not be covered by the recipient insurance for the donor would be any travel expenses that they may have, as well as the time off of work needed for workup and recovery. A donor's average recovery is 4 to 6 weeks after surgery. Who is not a good living donor candidate? Anyone with uncontrolled high blood pressure or on blood pressure medication under the age of 50. If a donor is 50 years or older and only on one blood pressure medication, they can still be considered. Otherwise, anyone with diabetes, heart disease, kidney disease themselves, cancer, obesity, which is defined as a BMI or body mass index greater than 35, any active or untreated substance abuse, active infections, or HIV positive are not candidates for donation. With living donation, there are a few different options available to our donor and recipient pairs. These options include direct donation and non-direct donation through a paired exchange program. Our medical team will discuss which options are best for both you and your donor once you are approved. How do we know you and your donor are a match? To figure this out, we need two things: a blood type and a cross match. There are 4 different types of blood: blood type A, B, AB, and blood type O. Blood type O is the universal donor. This means they can donate blood to anyone. Blood type AB is the universal recipient. This means they can receive blood from anyone. It is important to note that in the setting of transplant, the positive and the negative in a blood type, for example, O positive or O negative, does not matter. A cross match is the mixing of blood or tissue to see if a donor can directly donate to their recipient. A negative cross match in transplant is good, and on the other hand, a positive cross match may mean the risk of direct donation would be too high and other options available will need to be discussed. Donors go through a similar process that the recipient does to get on our waiting list. All donors see our entire multidisciplinary team, complete lab work, have imaging done to look at their kidneys, as well as complete additional testing based on their lab results. Once all testing has been completed and our team feels that no further workup is required, the donor is then presented at our selection committee for medical approval to donate. It is important to note that for all billing purposes, donor evaluations and testing must be done at Froedtert Hospital. After donation, the average recovery for a donor is 4 to 6 weeks. All transplant centers are required to follow their donor for 2 years after donation. Follow-up appointments will be made for the donor 7 to 10 days after surgery, at the 6-month mark, 1 year, and 2 years after donation. Once the 2-year reporting period has been completed, donors are highly encouraged to follow with their primary care provider annually to ensure continued health. There are no dietary or lifestyle restrictions for a donor after donation except for the use of NSAIDs. It is, however, very important for a donor to continue a healthy diet and lifestyle after donation. Donors can live a completely normal life with only one kidney, as their risk of developing kidney failure is minimal. It is completely normal to feel uneasy when talking to others about kidney donation. The most important factor is that you are comfortable with your story and disclosing the fact that you have chronic kidney disease. There are many ways to make others aware that you are in need of a transplant. Some of these ways include things such as assigning a donor champion or someone who can help spread the word, creating an outreach list of people to send a letter, card, or email to, creating a post on social media such as Facebook, Instagram, or Twitter. Other great places to get the word out that you are in need are church groups, neighborhood communities, billboards, bulletins, alumni magazines from high school, college, t-shirts, stickers, signs, you name it. More to get the word out that you are in need, the more potential someone may come forward. Remember, donation will only occur if it's in the donor's best interest. The positive and the negative in the blood type does not matter in transplant. There are alternative options available to our donor and recipient pairs. All costs related to donation are covered by the recipient's insurance, as well as people can live a completely normal life with one kidney. Their risk of developing kidney disease is minimal. Anyone interested in receiving more information about living kidney donors or interested in starting the process should contact our live donor team either by phone, online submission, or by scanning the QR code that is noted below. As always, we look forward to working with you. Thank you.